So I wanted to start out by saying thank you. Thank you again to Orem for hosting us. You guys have created such a beautiful center here for us, and the fact that you allow us to use the space, and you've taken care of dinner again for us. We really appreciate you guys doing that and helping us out. And I know it's a busy time of year for labs, and so for all of you to spend a few extra minutes with us or time with us, we appreciate it because there's a lot going on, and we're getting close to the end of the year. So thank you for that, and thank you for everybody for showing up. I think this is always fun to get people together. I think we had a great start with Wally last time, and we're gonna, again, every 2 to 3 months put this together. We'll kind of go back and forth a little bit with patient communication, with treatment planning. And so today we're going to focus a little bit more on patient communication. If cases come up or if there's stuff that we want to talk about, we absolutely will. But we're going to focus a little bit that way today and really start to think about why we're doing the things that we're doing to make sure that we can do this for a long time. And I think ultimately, as an organization, as the partners that we have in this room and the dentists that have been with us a short period of time and then a long period of time, and the group continues to grow. We have so much that we look at, and how does this long term play out for us? How has Ranchlands been around for coming up to 45 years in May? Choo Choo's been around for 30 some years. I'm not even sure. Yeah. Royal Oak 20 plus years. Like, there's a reason that we get there. And I think sometimes we get so caught up, especially coming to the busiest time of the year, as to like, oh man, we got patients and we got procedures and we got people that are upset, and we lose track of like why we're doing it and what's going on. And so today we're going to take a look at that and then talk about, again, how to communicate better with each other, with our peers, with our families, and ultimately with our patients. So if we believe that this is our goal, patients for life, and I think it's interesting because I was lecturing last week and I told somebody, I said, our goal is to have patients for 10 years. And they're like, well, why not for life? And I'm like, well, that's what I mean by saying for 10 years, but life is different than 10 years, right? 10 years is a short period, and hopefully most people are living to 80 or 90 years old. That's significantly different. And we know, if you've been in the industry for a long time, you will have seen 2, if not 3, sometimes coming up to 4 generations of patients. And so that truly is a patient for life. And so why is it that our patients continue to see us? Or what is it that we can do to make sure that they continue to want to see us? So our primary goal is not patient acquisition and retention, it's wellness. How do we make sure that our patients are staying with us and getting more, and that sounds weird, more well, right? Are we making sure that our patients are actually healthier at the end of what we do? Because sometimes, again, we get into that race of just getting work done, and we're talking to them about brushing and flossing and getting their fillings done, and we're missing some of the other important things that could be going on in their lives. Some of the other health things that we may not have time to look at. When we're looking at medical histories and we're seeing, diabetes or other health concerns on there, are we having conversations that are above and beyond the DO or the crown prep or the Invisalign that necessarily needs to be done? So here's the 2 things that we think create a lifetime patient: health and wellness. So we want to be working with our patients, not telling our patients what to do, but working with them, and then creating this wellness thing that is above dentistry, that is bigger than the dentistry that we necessarily do. And so you'll see that focus come through. I think you guys already do it again on a daily basis, but you'll continue to see it come through with the posts and the stuff that we're doing. With our teams, because ultimately, if our teams are not well, how will they be able to treat our patients? And so you're starting to see now, Bramlin having some fun and Jess having some fun with some of these yoga videos that are coming up, and just some of the other things that I know you guys are all excited to get involved in. We've had a couple of docs reach out and say, hey, can I do some of those videos with you? And we'd love you guys to get involved in not only the funny videos, which I love, and Larry, your last one I thought was hilarious with, don't bug the dentist with the sign on your back, but there's been a lot of great stuff, the Men in Black stuff with Tanya, and each office is doing a lot of fun stuff. But what was really interesting is today, Invisalign reached out to us to use one of our social media posts that Safina put together. And that's quite interesting when you have a like, a third party reaching out to you and saying, hey, can we actually put you on our site because you did such a great video? And so this is, kudos to Jess for putting this together, obviously, Safina, but really all of you have been making some really great videos. And our focus is not going to be just on fun. It's going to be on these health-based videos as well as fun. So I think you need to, balance, both sides of what we're doing. So let's talk about three things. And part of this, and I know some of you were there, but the Ritz-Carlton thing that Wally just put on recently, some of these concepts of customer service are going to come through as we look at that. Some of the stuff that we're already doing, and then how do we lean a little bit more into what we're looking at? So what's our philosophy? What's our communication model? And what's our service experience? What are people experiencing when they come in? Because here's what I truly believe, that even though we do dentistry, we're in the customer service business, because all of our patients have the ability to find another dentist down the street. Like, there's so many dentists around. Every one of your offices within a couple hundred meters has another dentist. I mean, I keep driving down 4th Street because I live there, and it's like, if there wasn't enough dentists on 4th Street already, there's now 2 more, right? Like, it's like absurd in terms of like how many. I think there's now 20 some, offices or clinicians in a 3-block radius on 4th Street, right? So ultimately, what are we going to do that's going to be different for our patients, that is going to make sure that they experience us not as dentists and as hygienists and as assistants, but as their healthcare providers, as people that are going to make them long-term healthy and also care about more than just their teeth. All right. So you guys can do this if you'd like, to pull out your phone and answer it on here. If you prefer to just shout it out, I'm happy with that as well. But what are we doing well? So if you pull out your phones, I like it because we'll have a record of it if you don't mind pulling out your phones, because then it'll show up on the screen and we can actually keep track of it. So if you do this, it should pop up, and then you could type in really anything you want. I like Slido. It works really quite well for this. Is it working for you guys? Is it coming up? Yeah. All right, perfect. It's like in real time, we can see you guys actually. Okay. Right, so this is really interesting, and I love when I see this, because the majority of this doesn't actually have to do with dentistry. As I look at this, like friendly faces, patients choose, okay, the new patient experience does, but relationships, respect, quality, building trust, not production-based, building good rapport. But then technology is a part of it, and that's actually something that we will chat a little bit about today, because how does that make us different? And do our patients actually understand how much different we are than some of the other places? And I think they start to experience that as we do the new patient experience. So I'm going to keep going. So the next question, if you actually haven't turned it off, it'll just pop up. If you have turned it off, then you'll have to scan this again. Where do you think we could do better? Based on what we're already doing in our offices, what is it that you think we could improve on? Okay. This is awesome. So I like this too, because creating a uniform experience, personalization of experience, slowing down to make sure Timmer wins, commitment to consistency, slowing down to speed up. So you guys are like perfectly teeing this up as to what we're going to chat about today, because the thing is, it's funny. We're not trying to improve necessarily our clinical skills, which ultimately are so important for what we do, because our patients expect that. But here's the thing for me, is that I actually think that that's what we do well. And our clinical skills continue to improve because we all go to CE courses to help us build those set of skills. But to me, that's the expectation. Our patients come in expecting we know how to do dentistry. I mean, they're not showing up hoping that we know how to do the work that's necessary. They expect that we do know how to do the work that's necessary. But how do we do some of these other pieces? So let's chat about some of these, because I think this is excellent in terms of what we could do. I don't know how to turn off this. Hold on. So why am I showing the schedule? Any ideas? This is a schedule. There's actually, well, now you'll know where, because it's yesterday's schedule. It was mine. Not mine. I was working part of this day and you saw some of the stuff, but this is yesterday's schedule. So when you see something like this, for those of you that are in different offices, what are you noticing here that may or may be different or maybe exactly what you guys are doing? Okay, so what I'm going to tell you is this is Dr. 1, this is Dr. 2, this is Dr. 3, and these are 5 hygiene columns, and this is pedo. How stressful does this day look for any doctor? Anybody stressed looking at this? It's pretty much hour appointments. I've got some hour and a halves, pretty much hour appointments. How does that day look to you? Not going to ask the pediatric dentist because this would make no sense. In pedo, this would make 0 sense. Yeah, it's that's your morning, right? But for those of you that are doing, dentistry in our offices and are having these days where it said, somebody put down slow down to speed up. We don't need to slow down. This is slow, right? But this is an amazing day because this is how my expectation of what an ideal day would look like, right? And here's the crazy thing is we didn't engineer this. This is what we show up to. This is what MEBS gets to experience. MEBS, this is actually pretty normal, right? Yeah. This is, when you see MEBS work, he works really hard, but that's his normal day. This is Hardeep's normal day. Mine is all over the place. It just depends on, what's going on. But running single column dentistry, doing procedures quickly and efficiently is the best way to do dentistry. Why? Why does this work? There's so many different reasons, but what is it that makes this necessarily more successful? Because I promise you it is. You'll produce more on this day than you will on your days when you're running with your head chopped off. But what makes this different? Sorry? Focus isn't split, so that's great because we don't have 2 patients in 2 columns, right? All 3 of us share this one column. You'll see Hardeep has 2, there's 1 status exam, MEBS has 2, I don't have anybody in that column, right? So we're focused in one spot. What else? What else makes this effective? Right? Patient care. Once I freeze this patient, where else do I have to be? Nowhere. Possibly a recall. And there are a fair amount of them, but when you got 3 dentists and 5 hygienists, recalls are not too crazy. And half the day you'll notice when it just says S3, there's no recalls on half of these patients because we're doing, the recalls approximately once a year if they're coming in more often.
Is your microphone on?
Can you hear me? Is it not loud enough?
I'm not hearing you out of this.
Okay.
Sometimes you mumble.
All right, let me try this a little. Is that better? Louder? No?
Still not hearing you.
Okay, is that any better? Kind of? Yeah. Okay. I don't know, maybe I'll come over to this side and talk, I'm not sure. But what's making, so we have time here to sit with the patients. We have time here to talk to the patients to make those relationships that make them patients for life. Right, I had a patient, one of these patients, my 37 extraction, won't give out names so we won't be offside, but interestingly enough, had seen dad, full mouth done by Wally, implant done by Hardeep. And then nobody wanted to take out the 3.7, so that became my problem. And I told him, I was like, okay, I took out the 3.7. I was like, do you want to see me or are you comfortable seeing Hardeep for the implant that you need? And interestingly enough, there's a 35 implant on this guy. And I was like, well, who did that? It was Blue. Guess who did the 35 implant on this guy? You. I was like, Wally does implant? 10 years ago, you did an implant on this gentleman, and it was still really good. Again, full mouth, 28 units, right? Like this guy was like, well, everybody I've seen at Ranchons has been amazing. I'm happy to see RDeep to get my implant. I don't care who I see. Because the relationship was so good with the patient for 30 plus years that it didn't make a difference. It wasn't about who they were seeing, it was the experience that they got over and over and over again. And so I'm going to get you guys to look at how you're doing things to say, is it possible to slow down? Because how are the assistants feeling on a day like this? How are your assistants feeling? Because we're hearing about it. Some of them are feeling a little run off their feet sometimes, right? We're looking for more help so that we can help manage that. In a day like this, the assistants are feeling pretty good because they have enough time to also manage the schedule, right? We each get one assistant each. There's one assistant in pedo, and we have a steri, right? So that's what's running the day. Fortunately, our steri is also now past our RDA, so we technically have an extra assistant if we needed it. And I think it's a great benefit to have a steri person that actually is an RDA because they can step in as well. But my point about this, and somebody else put it, slow down to speed up, is that we need to be able to do procedures very quickly and slow down with our patients. And that's got to be the goal that we work towards, is not seeing so many patients at the same time, but getting more efficient with our timing in procedures so we don't have to put so many people in the schedule to do the same thing. Because each dentist this day can do over $5,000, which many of you running 2 columns may not necessarily get to, right? When we can do procedures quickly and spend time with the patient, we will win in the long run because our patients will experience us to have more time. They won't experience us to be super busy, to run off our feet, to be going between operatories and not necessarily spending the time with them. And this is where that customer service piece keeps those patients. Because ultimately, I do think in Calgary, like we've been really lucky. Again, things continue to get busier and busier. All of the offices, fortunately, are getting busier and busier. But I don't think we're going to have the same inflow of patients moving across the country as we've had in the past. And so how do we keep the people we have? Because the average dental clinic loses somewhere between 10 and 15% of their patient load a year, right? So if you have 2,000 patients, you're losing 300. But what if you were losing 200? Well, what if you were losing 100? Do you need that many new patients? You don't. And the interesting thing with new patients is it takes longer for us to do a lot of treatment on a new patient than it does on an existing patient. Why? Because they don't trust us yet. It takes a little bit more time to sometimes build that up. Not always. Sometimes you can get some great cases out of new patients if they're referred to you. That makes a massive difference. But it takes us longer to get treatment out of new patients. I mean, and we see this consistently as a new office comes on board, the crown and bridge work really ramps up in year 2, 3, 4, 5, not year 1, because again, the patients aren't quite sure. They're still feeling you out as an office to make sure that they trust you to do the work that they need to do. All right. So can we work with our patients to create treatment plans that work for us and for them? And so I'm not going to get into all of these, but are we looking at their risk ahead of time, right? So I know that we continue to look at our new patient experiences and our new patient forms. I know some of our offices are using the COIS form ahead of time because we can figure out risk before they show up, right? Tailored wellness plans, minimal invasive dentistry, and then what is the link to the rest of their body? And I think that we're doing a decent job of that, but I think there's still so much opportunity for us to prove that we are truly involved in their overall health, not just their dental health. All right, so let's talk about talking with our patients. Now, some of you have seen this before. We've done this a little bit, and so I'm not gonna go over it too far, but you know, we want to talk a little bit about some of those concepts that we learned from PrimeSpeak so many years ago. Actually, Orem, you brought in PrimeSpeak, I think, many, many years ago. We went down and did it with LVI as well. And so how much dentistry does the patient want when they walk through the door? None, or hardly any, right? They want a cleaning and they want to be told that everything's fine. And what do we want for the patients? How much dentistry do we want for the patients? I don't know, depends on the patient, right? We want ideal oral health for our patients, that's it. That could mean 4 quadrants of root planing and they're out the door. That could mean a full mouth reconstruction. We're not really sure because we haven't looked inside their mouth. But ultimately, we want ideal health, they want nothing done. And then we've got to try to figure out how to bridge that gap. So what are the gaps? 3 gaps that get us from A to B. What are the 3 gaps that stop our patients from doing treatment? Money, fear, and time. Okay? So here's what we know. That I don't think we're as scary as we used to be. I think we've done a much better job of managing patients. I think our baby boomers are still the ones that are really scared because they've had those really bad experiences. But anybody that's a little bit younger has had, I think, pretty decent experiences coming to the dentist. So I think we could take care of pain, and if we can't, we send them to a couple of you guys, you put them to sleep, and then they don't have to worry about it, right? Like, I mean, there are ways around managing fear if we need to. Time. I mean, all of our offices are open 2 Saturdays a month. We have some evening time. I think we've actually figured out how to get them into the schedule. So really it comes down to money, right? And I think one of the points that somebody put up there was helping our patients manage their finances, right? So who believes that money is the biggest reason that our patients don't get treatment done? Right? Most of you believe that? Okay. So if you're nodding your head and you believe that, you are the problem in the situation. Okay? And I'm honest, I'm dead serious. Because how many of your patients have not gone to Mexico or the Caribbean or Hawaii in the last 12 to 24 months? How many of them don't have an iPhone that's within 2 to 3 years old? How many of them don't have a car that's fairly new? Look at the clothes that they're wearing. Can they afford a $1,000, $1,500 crown? Yes, absolutely. In almost every situation, not every situation, we do have people that absolutely cannot afford dentistry. There's the CDCP, and we have some systems around that. But if we think that the reason that patients aren't doing treatment is finances, then we're creating the problem for our patients. Right? Like, how often do you have trouble getting patients to do treatment? Right? But it's interesting, right? Because what is it that's stopping our patients from actually doing the treatment? Value. That's it. They don't value what you're talking about. They don't actually think it's important. If they don't think it's important, why are they going to do it? And then it's a combination of that, and then they trust you to do it. Because how often have you had somebody come in to get a second opinion and the treatment plan was sound? Why are they coming for a second opinion? Because whoever told them the treatment plan didn't trust them. I had a great one literally walk into my door last week. 2 extractions, 2 implants, and a bridge on top of that. Not only was it treatment plan, they brought me the pre-authorization by Blue Cross, all covered. Everything was covered on the treatment plan, like to a portion of. All the implants, extractions, everything covered. And they said, we've known you, my daughter's been seen by you, the daughter brought the dad in. Here's the treatment plan. 1, do you agree with it? The treatment plan was sound. Actually, I knew the dentist that did the treatment plan. And they said, can you do it? I'm like, yeah, absolutely. And he was actually if I go back to my schedule, the last patient of my day yesterday was 2 extractions and grafts. That was it. Great. So it wasn't that they couldn't afford to do it. Why did they leave that other office? Why did they come to us to have it done? Value and trust. Those are the 2 things that make our patients do the treatment. It is not finances, because we can manage it. Evan, how's it going? For those of you that haven't, I'm just going to make a big deal of it now. Evan is the newest dentist on the team, so Evan is just, so pretty much nobody has met him. Well, he's been to a few offices, but he's the newest addition to the team. He's working over at Sage right now, and I know he had a longer day, so he's coming down from there. Yeah, so thanks for joining us. But value and trust, okay? So how do we build value and how do we build trust? Because if those are the reasons people are doing treatment, then we got to figure out how to build that treatment out, right? We got to figure out how to build value and build trust. Some of this starts with our level of confidence. Are we confident in what we're talking about? Because if we're confident in what we're talking about, that actually builds trust in our patients, right? They can feel whether we're comfortable doing the treatment or not, or whether we're going to send it somewhere else. So I think I've shown you this already. I don't know that we'll spend too much time on it. But the biggest challenge patients have is they cannot see themselves in the future. So if you look at yourself in the mirror and I tell you, think of what you're going to look like 10 years from now, that is impossible. Our human brain cannot see ourselves in the future. We can see other people in the future. If you want to know what you're going to look like probably 20, 30 years from now, look at your father or your mother. That will help you along your way. But we can physically not see ourselves in the future. It's just something that our brains will not allow us to do. So when our patients come in, and one of these cases that we had last time that you guys brought up, the severe wear patient, that I think Cheyenne's case, right? In a situation like that, our goal is to show them what their future would look like if they do nothing. Because what do we think? Like when we're talking about dentistry, what do people tell us? Like, what is our job as dentists to do for our patients, apart from the dentistry? What are we supposed to do? What does everybody tell us we're supposed to do? As we're meeting our patients and we're talking about treatment, what are we doing for our patients? Educating, right? So that's what we thought, right? Is that not one of our things? And so I'm going to disagree. I'm going to tell you that we actually are not supposed to, our goal is not to educate our patients. Our goal is to show our patients a picture of the future. And there's a distinction between the two. Because educating the patient is telling them why this tooth needs a crown. And who cares, really, right? Does the patient really care? What do they care about? That they're able to chew on that tooth 5, 10, 15 years from now, that they don't need an implant, that the tooth exists. So when we get into our education part of dentistry, we can turn off a lot of patients, right? Short of them being an engineer and wanting to know the megapascals of a zirconia crown, which I don't know, but Paulie could probably tell you as to what that ends up being and all the different, actually we got Forum here, so they could tell us all the different levels of what that is. No patient cares. Like there's not a single one that really cares about what material we are using. They care about it lasting for a long period of time and us helping make them healthier. So painting a picture of the future. So what, I'm going to just steal from PrimeSpeak. PrimeSpeak calls this TREC, the damaging results of the existing condition. What are the damaging results if I do nothing today? If I leave my tooth the way it is, what will the future look like? Do we all know what the future will look like for most of our patients' teeth if they do nothing? Yes. Have we seen a large MOD amalgam on a lower 6? What's going to happen? Something's going to break. And what's going to break? The amalgam? No. Amalgam's going to stay there for the rest of their life. The only thing that's going to break is a cusp off that tooth. We know that, but do our patients know that? Can we show them a picture of what that future looks like? Do you have one of those? I mean, you've probably done a million of them. But is that what we're showing? Showing a picture of the future to our patients and then allowing them to decide whether that's the future that they want. Because here's the thing. It's not my job to sell you dentistry. It's my job to help you understand the consequences of your decision and supporting you in the decision that you will make. That's it. Because who's in control? Patients. Patients want to be in control. Ultimately, the goal of the patient, anybody, when you start with your 2-year-old, what's one of the first words our 2-year-olds learn? No. We all have them. Well, we've all had them. Not all of us, but many of us have had them. No, right? They're very good at saying no. Why? Because nobody wants to be told what to do. And in dentistry, we're really good at telling our patients what to do. And that turns patients off. And so our goal is not to tell them what to do. Our goal is to bring them as a part of the conversation, have them understand the consequences, and then support them in the decision they made. So again, PrimeSpeak taught us this. It was called the new patient dance. And what they said is when I step into a patient, When I start to tell you what to do, what do you start to do? Start to resist. Because if I start pushing, your natural tendency is to push back. That's what people do. Or they walk away. Either of those are bad situations for us. When I stand still, we give them another option. But if I back up and I try to bring somebody along, it's interesting how fast they join you. And here's just like a simple example. So you pretend I'm walking into Ranchlands and Monsi's at the front desk. I'm like, Monsi, at 5 p.m. today, before you leave, you need to talk to me. And then I go to the back. What do you think's going through his mind? What do you think? I'm in trouble, right? Yeah. Then I come back at noon and I'm like, Monsi, at 5 p.m., do not leave this office. We need to chat about something. Yeah? What does he actually think is happening at 5 p.m.? He's getting fired, right? Because we're human beings, and as human beings, we make up stories. And if you think you don't make up stories, it's this monkey in your head telling you don't make up stories, that you're making up stories. We just make up stories. We have to, because we have to justify why things happen. So we make up stories all the time. And all I wanted to do is figure out, Ranchlands Christmas party's coming up. We got to figure out the drive. We got to figure out how people are getting there, how they're getting home. We're doing dinner and a show, and we got to figure all that out. So that's what I wanted to talk about. But at noon, when I come up to Monsi and I say, hey, we got to talk at 5 p.m., what does he wish I would do right then? Just tell him. Isn't it interesting? The less I tell you, the more you want to know. The more I tell you, the less you want to know. And all we do is sit there and lecture to our patients all day long. How many of your patients hate going to the hygienist to hear about they need to brush and floss more, right? Our patients complain all the time about that. Well, they tell me I need to brush and floss more. I know that, right? Is it changing? Do any of our patients actually floss? What is it? The metrics are 15% of people actually floss on a daily basis. So how are we doing as an organization of making people floss? Not terribly well. Do most of our patients know electric toothbrushes are good? Most of them. How many people use an electric toothbrush? Less than 20%. So we're not doing a good job of lecturing to our patients about telling them what they need to do. And if we're not doing a good job of that, and they come in 2-3 times a year to see us, we're doing something wrong. And it's because we're telling them what to do versus inviting them to be a part of the conversation. So I'm not going to ask you this question as to how long you spend, because I hope that everybody just spends an hour, because that's our expectation. So we all spend 60 minutes. And here we go. Look at this. We changed up our picture. This is a nice picture. Look at that. UD, we got the mug. I think sometimes we forget why we started this new patient exam in a consult room. Because we always say that we want to build trust with the patient. We've talked about that. But I think there's something else that we sometimes forget about, what's going on in our patients' minds when they enter an office. So patients outside the office, and they walk into the office. What their level of anxiety is what now once they walk through the door? Higher or lower? Obviously, higher, right? And then we take them and we put them in an operatory. Did their anxiety increase even more, or did it go down when they got to the operatory? It increased even higher, right? So when a patient enters our space, their anxiety naturally increases. I don't care what you're talking about. Every patient has some level of their blood pressure and heart rate increase just slightly when they walk in. Many of our patients could increase significantly. Then you put them in an operatory and you sit them in the dental chair, their anxiety increases. So when your anxiety is high, or when there's hormones going through your brain, are we in the sympathetic or parasympathetic nervous system at this point? Right? So we're in fight or flight, right? So our patients are in fight or flight. What happens to your ability to think when you're in fight or flight? Disappears. You cannot. You are only reacting in a fight or flight situation, okay? So think of this again. We have a patient, we put him in the operatory, we tell them all of this information, they're in a high stress environment, they get to the front's like, oh yeah, so Dr. Jaffer talked about the 2 crowns of the filling, and what does the patient say to the receptionist? I don't remember them talking about that. And we think the patient's stupid, right? And ultimately, that is not the case, obviously. The patient cannot remember all the things we talked about because of the level of stress that they were experiencing at the time that we're talking to them. So what are we doing sitting here in the consult room? Our goal is to build that trust, to lower the anxiety of our patient so that by the time we bring them into the operatory, they're having a better experience. So it's not about just sitting there and getting to know your patient. I mean, that absolutely is part of it. As you build a relationship, what happens to anxiety? It does decrease because we start to build trust. When you trust somebody, you're less anxious around them. So think about why you're spending that time with the patient. Our goal is to get to know them, but our goal is ultimately to lower their anxiety so that they have a better experience with us. Because our patients that come and see us over and over again, do they experience the same level of anxiety every time they come in? My hope is no, that it gets better over time because they get comfortable with us, right? I mean, that's something that I think, in the pediatric world, you guys do well, is you have to sometimes break these things down so many times to get the patient to trust you. But once you do, they become patients for life, especially those anxious patients that haven't trusted you before. They're never leaving because they don't want to start that relationship again because it's hard. So take your time, get to know them. Don't put them in an operatory until the last time, until you absolutely need to, because this is your opportunity to make sure that they are ready for that experience. Okay? This part number 3 here, planning for the exam. So when somebody smiles at you, as a dentist, do you have like a bit of an idea of what's going on in their mouth? Like, can we like diagnose kind of quickly on an average patient? Like, even when we're like having dinner with people, are we not like mildly diagnosing what's going on in their mouth at like all points in time? And they know that too, right? Like our patients that are, our friends that are patients, are like, are you like checking out my teeth? Yes. I mean, that's what I do for a living. So we can figure out what's going on in a patient's mouth without them actually having a full exam and x-rays. Now, we can't know everything because we can't see all of their teeth, but we have a bit of an idea, right? So if we have a bit of an idea of what's going on in our patients' mouths, can we pre-plan what we're going to talk to them about? So this is like where some of this pre-planning, and again, I'm going to give Prime Speak some of the credit for some of this. Like, they helped us talk about, you need to be able to see the future in the patient's mouth to talk to them before they open their mouth. If you can do that well, it opens up a massive door for what you're able to do. So let's just pretend, I'm always careful as to how I put this, but I'm going to say middle-aged women. I'm not going to say what age that is, but let's just pretend middle-aged women, okay? What is important to a middle-aged woman? I want to look younger. Okay, that's just like a generalization, but true, right? And if they've taken care of their teeth, so let's say you walk into somebody and you see somebody and they've got a pretty nice smile sitting across from you. And you're like, okay, I don't think they're going to need a lot of dentistry. They look like they take care of their teeth. What is it that's still a possibility that's going on in their mouth? If they tell you they haven't really had a lot of treatment done in the past, what still could be going on in their mouth? Perio, some level of malocclusion, some level of sleep, right? Now, again, looking at them, you could start to figure this out. But if you have somebody that you think actually has really great teeth, one of the things that you could start with is, hey, we have a lot of patients in this office that want to keep their teeth for life. And what that means for them is that they are coming in sometimes 3 and 4 times a year to get their teeth cleaned so that they can keep their teeth for the rest of their lives. I'm not talking about you, I'm talking about our patients. And let's flip that to another situation. You can tell as you're looking at the person that a bomb has gone off in their mouth. Okay? We have patients come in here on a regular basis, and they just haven't had the ability to get their teeth taken care of in their past. And they're here, and they're ready, and they want to do something to make their smile nicer. And these patients will sometimes have treatment that costs $30,000 to $40,000 worth to get to the finish line. What did I do in that situation? I'm not talking about you, I'm talking about our patients. Okay? The concept is called widening the goalposts. We are taking a situation and letting people know that there are patients in our office that have spent $40,000 on their treatment. So when I come up with a treatment plan in 15 to 20 to 30 minutes from now, and it's $3,000 to $5,000, what are they thinking? Well, at least it's not 40. Versus if you haven't set them up for that before, when you get to a $3,000 to $5,000 treatment plan, what do they think? You're nuts, right? You're setting up the conversation to allow you to do really good quality work down the road because you've got a bit of an idea. You're also setting up your hygienist for success because a lot of our patients, although their teeth look healthy, like if I came in and I wasn't a dentist and I came in and I said, look, I've had braces, had Invisalign, and never had a filling in my mouth. You're thinking, okay, that probably doesn't need any work. Then I went to my hygienist over at Creekside and they told me I had a 5 and a 6 millimeter pocket and I needed to come in every 3 months. But if I didn't know dentistry, I'd be like, well, what do you mean? I've never had a problem in my mouth my entire life. I'm 46 years old, never had a filling. Why do they want to see me every 3 to 4 months? They just want my money. Not if they didn't have that conversation before saying our patients want to keep their teeth for the rest of their lives. Do you want to keep your teeth for the rest of your lives? Well, this is what that's going to take. Because if I keep letting happen what's happened and I do the dentist thing about when do you get a cleaning? When does the average dentist get a cleaning?
Once every 8 years.
When there's an opening in the schedule. Or exactly, like when there's an opening in the schedule and nobody's doing anything. And so you and the hygienist have to have a perfect, timeline of nobody in their chair and nobody in your chair. And when does that happen? Yeah, once every 8 years, right? Like it doesn't happen often. So I'm now on a 3-month hygiene, right? I'm pre-booking my hygiene for the first time in my life. I'm pre-booking my hygiene. Crazy, right? We talk about this with patients all the time. We need to do it too, right? But if somebody doesn't explain it to you, and again, it's not like other hygienists in our organization haven't explained it to me, but this time when they went through it, and I had a dentist come in and also tell me that I've got some larger pockets, it's like, it starts to like make a difference in your mind that you want to keep these teeth, right? So this is all set up before we take them into the operatory. Isn't that interesting? Because what's the biggest universal fear in life?
Public speaking.
It's one of the top 5, but it's not the most. Biggest universal fear in life is rejection. We all want to be part of something and not the person on the outside. You don't want to be the last person picked to be on the soccer team. Like, when they used to pick, people and you're on the playground, doesn't it suck being last? It absolutely does. And, hopefully you've all experienced that once. I definitely have. It's like, that's the worst feeling if you're the last person picked. Because none of us want to be rejected. So when I tell people that, hey, we have a lot of patients that come in every 3 to 4 months for their cleaning, it's not you that's special. That's what our patients do. That's normal for us. That's normal for you fit in to what, like our average patient. Because if we have 30 to 40% perio, which is like a statistic that makes sense, then that means that 30 to 40% of our patient population should be coming in more than twice a year. So you're normal, right? And we have patients with pretty big treatment plans that spend a fair amount of money with us because they want their teeth back. I don't know if I ever gave you the example, but I thought it was really interesting, and maybe I have, but actually, funny enough, this was a course that I took at Orem with the LVI Study Club, and we had, who was one of the implant guys that came out. And he put up a pan, and there was 24 implants in the patient's mouth, 24 implants, and a crown on every tooth, individual implants. He showed us the scan before, pneumatized, like hardly any bone, and they went from hardly any bone to grafting everything to putting in an implant for every tooth and putting a crown on every tooth. And so there's a group of dentists, obviously, we're all in this course, and somebody's like, how much did that cost the patient? The guy's like, about $200,000. Right? And the dentists are like, this is ridiculous. Like, and this is kind of pre all on four stuff, right? So like, I mean, you're able to do it, but we were doing more single units back then. This was a little ridiculous, but we were doing more single units back then. And so the dentists are like, $200,000. Like, wait, what are you talking about? So he said, okay, fine. I'll make this deal with any of you. I'll pay you $200,000. Let me take out all your teeth. All of them. You have no teeth left. Which one of you is signing up for that? And this is when it finally made sense to me, is that if I'm not willing to give up my teeth for $200,000, then why on earth wouldn't somebody be willing to pay $200,000 to get their teeth back? What are your teeth worth to you? 200, 500, a million, 5 million? Like, what are your teeth worth to you? Knowing what you know. And then we think patient financing is our problem for people having teeth to eat on? Like, I'd never seen a stat like that, and then I'm like, there's no way in hell I would give up my teeth for $200,000. I don't think $1 million would be enough to give up all the teeth that I have that I can chew on. Because we see what our patients go through as they lose teeth. And yes, can we do implants and can we do all on four and we can do some amazing work. But is it like your natural dentition? I mean, never. So why on earth are we concerned with the cost of what we're talking to patients about treatment? It's not our job to own their treatment. It's our job to help them get the ideal treatment. It is their job to choose what they want done. And so when you think about it like that, it changes your thought process around what's an expensive treatment plan. All right. How does the patient get from the consult room to the operatory? The dentist walks them. This is still your time to spend with the patient. And then what happens when the dentist gets the patient to the operatory? What do we do? What should we do? Who should be in the operatory? How about that? Okay, so there's your hint. So what should the dentist now do? Introduce the assistant and one more thing. Create a connection between the assistant and the patient. So if I was in the consult room and I learned 5 to 10 things about my patient, and I learned that the patient had a dog, I'm not sure. If I get into the operatory and I know that my assistant has a dog, is that not like the best connection you could possibly make, or a cat? Because what are they about to do now? Pull out their phones and start showing pictures of their dogs or their kids or their cats or their whatever end up happening. Your job is to create a connection between the assistant and the patient, because we're trying to build patients for life. And if they trust the assistant, are they more likely to do the treatment? Yes, they are. If they trust you, are they more likely to do the treatment? Yes. And are we doing that? Are we leaving the patient in the consult room, getting the assistant to pick them up and go take some x-rays and a scan and put them in the operatory? Because we're hearing that's happening at offices. We're hearing that our patients are getting x-rays taken before the dentist has done a clinical exam. And I'm going to tell you right now, you are well offside of what is expected of you as a dentist. If you have not looked inside a patient's mouth, you cannot have x-rays taken on them. That's just below the standard of care. Right? Our assistants can't diagnose x-rays. Technically, hygienists can. But what's the expectation? What are we creating for that patient so that they know that this is their treatment plan, not we just run everybody through this mill of whatever it ends up being. So walk that patient back, introduce them to the assistant, have a conversation, and then start the clinical exam. Over the patient exam. This is something, if you can do well, also makes a massive difference to the patient. Charting should be done directly into the computer system. I believe all of you are doing that, but if you're not, we can help you figure that out. Nothing should be written down on a piece of paper. We should be charting in real time. There's simple ways of doing that. Don't go tooth by tooth. What's the fastest way to chart? Tooth by tooth or what? Procedure. pick all the amalgams, pick all the white fillings, pick all the crowns, pick out the tooth number. There's a fast way to do it. You can have all the treatment, you could have everything charted in a couple of minutes. If you and your assistant are on, because it goes in an order, right? We know that Dentrix goes code 1, 2, 3, 4. So you pick all these, say, tooth 1, 6, 8, 10, whatever, not like that, obviously, 2, 1, 3, 2, and then amalgam, and you go back and you give all the surfaces. But as you're doing that, make sure you're talking about what you're seeing to the assistant. 3, 6, there's a silver filling that goes from the front to the back of the tooth, 3 surfaces, and I see a crack going down towards the tongue. What do you think's happening to the patient when you say that? Right, that's probably it, okay? That's actually a good point. I already screwed that up. On the lower right molar, thank you. This is good. Well, he's done prime speak before as well. Lower right molar, lower right tooth, 2 from the back, large silver filling with a crack going towards the tongue. What's the patient gonna do at that point? Many patients will be like, well, what do you mean there's a crack on my tooth? What's going on? You're like, no. Sorry, Susie. We're going to chart everything first, and we're going to actually invite you. We're going to explain this to you once we get you to sit up. So what did I just do to the patient? I pushed him back. What direction do they now want to come? Like I told them that I'm not going to tell them that. I'm not going to give you that information right now. So what do they want more? They want to know what's going on. And we keep doing that till we get all the charting done. And then we're stuck with this tooth. Put it up on the screen. Okay? So you put that up on the screen, and what do? Right? What does the average dentist do? Says you need a crown on 2.5, 2.4, 2.5, I don't know. Upper premolar, right? That's what we tell them. Well, what a dentist that's done this before and understand how to talk to patients, what would you do at this point? Start with saying nothing. Make it uncomfortable for just a second. Because nobody likes silence, right? When 2 people are sitting across from each other, nobody likes silence. So somebody has to talk. Do you know how negotiations work? Who loses? Person who talks first. Right? This is not a win-lose situation. But it also works with who cares more. Person who talks first. Who needs to care more about the tooth? You or them? Patient needs to care more. So you leave this up there. If they say nothing, you say, what do you see? And I'm not sure what they're going to say. I mean, you hope they're going to say, well, there's a little crack happening here. I'm not like, what's this yellow part that's showing up in the middle of my tooth? Right? Like this yellow piece in the middle of the tooth. Well, what do you think's going on? Well, I mean, I see a crack. Any idea what we should do? You ever done that with a patient? Ask them what to do? How old do you think this patient is? Okay? When's the last time you did a white silver filling on anybody? Right? Some of you probably never. Our younger dentists have never seen, like, what is this? No, I'm joking. How do you do an amalgam filling, right? I did these only in dental school. Once I joined Ranch Lines 23 years ago, that was the last time I'd done a silver filling. We were just taking amalgam out of the office. So this patient is probably 50 or 60 years old, or 70 or 80. They're not under 40, I can almost guarantee that. So, do you think they know what they should be doing with this tooth? Do you think somebody along the line has talked to them about it? I'm going to guarantee you they actually know what to do. They may say they don't, but the average patient that's this old, and you see that silver behind there, do you think they have a crown in their mouth? Yes. Or if they don't, do you think somebody along the way has talked to them about a crown in their mouth? Like 100%. Somebody has mentioned a crown at some point in time. So does the patient already know what the treatment is on this tooth? They actually do. So why are you telling them? Ask them. What should we do? Well, doc, there's a crack there. Okay. Any ideas how we can get that crack out? See what they say. I mean, Dr. Google tells them a lot, right? Now it's Dr. ChatGPT, right? That's the new thing now. It's quite interesting as to how that is going to change all of our lives, right? In terms of like the technology out there to help. I mean, if they could get a camera in their mouth, they would diagnose this themselves. The problem right now is that iPhones don't fit too well in people's mouths, but at some point, they'll have intraoral cameras that they could probably buy for about $10 and get ChatGPT to diagnose their mouth for them. I mean, it's not going to be that far away. We can't expect it. I mean, what do our mouthwatch cameras cost? Like $200-300? Like, this technology is pretty cheap. So let's ask first before telling. And if we can't get there, let's run through a treatment plan. So I'm going to go through a treatment plan with you. I'll do this as quick as I can, but I'll say, hey, Julie, first option you have is do nothing. Good news, costs you $0. All I'm going to tell you is that be very careful with chewing anything hard on this tooth. Because if you chew any nuts or ice on this tooth, what we could see is that part of this tooth, really this portion here, could easily break off. If it breaks off, if it breaks below the gum line, you're going to lose that tooth, or you may need a root canal, possibly a crown and a root canal, but you may actually end up losing this tooth and needing an implant on this tooth. Julie, your second option is a filling. Good news, going to cost you a couple $100. Insurance company's going to cover most of it. But what I'm going to tell you is you still need to be careful chewing on this tooth because the white filling doesn't really make the tooth that much stronger. It helps a little bit. And so no nuts, no ice, nothing too hard on this tooth because if it cracks, again, you may need a root canal, you may need a crown, you may actually lose that tooth, you may need an implant on this tooth. Julie, the last option is a crown. Downside's going to cost you about $1,500. But here's what we're going to do. We're going to take the silver material out, we're going to take that crack out, we're going to refill it with a white filling material, and then we're going to put a porcelain crown on top of there. Does that mean that's perfect? No, but that's going to give your tooth the best long-term option of staying together because we're going to hold that tooth together for you. Okay, so what did I do with my treatment plan? I went from, okay, all options, but, okay. So kind of, I talked to them about the consequences, so yeah, what else? I didn't actually show them a picture of that broken, which would have been a really good idea because that would be like, hey, you want to see what's going to happen in the future? Let me show you a patient that just came in last week that had one of these. What direction did I go with treatment plans? Okay, started with the worst, went to the best. And one other thing that's a little bit more nuanced is that when I started, the worst options, I gave the benefit first and the downside second. The best option, I gave the downside first and the benefit last. So I got the money out of the way. Downside of doing a crown is $1,500. Here's all the reasons why it's important. Okay? So Julie thinks about all of these and says, hey doc, this tooth hasn't hurt me for 50 years. I don't want to do anything on that tooth. Okay? What's next? What happens next? Sorry? Okay. Well, what do I have to do next? Because she's still in my chair. I've gone through all of my options. And she sits there and she says, hey, doc, I can't afford it. That's where she starts, right? I'm just going to leave the tooth the way it is. Okay, so I haven't, so, yes. So what do I need to do? That's it. I have to ask one more question before I let her out of the chair. Julie, tell me the consequences of doing nothing. She says, doc, you told me not to eat ice, not to eat nuts. That tooth could break. If it breaks, I could need a crown, could need a root canal, I could need an extraction, and I could need an implant. Are you asking your patients to explain that they have understood what you've told them? Because if you do, then when they get to the front desk, they don't look dumbfounded. Ask them, do you understand the consequences of what we talked about? And if she says all of that to me, what do I say? Great. See you in 6 months. And how many times do my patients come back and complain to me that I never told them this would happen? Never. Guess what happens when they come in and that tooth is broken? What do they say? Doc, you told me so. You told me that there was a possibility this tooth was going to break. right? So much easier than what we sometimes go through. And then, because what happens with the patients normally? Who do they blame for their tooth breaking? You, right? The average dentist will look at this and say, hey, Julie, I'm worried about this tooth breaking. I'm really worried that this tooth is going to break and it's going to cause you some pain and discomfort. I really think we should put a crown on top of this tooth. How many of you at 6 p.m. when you're having dinner with your kids or your significant other or you're out with your friends, are you thinking about Julie at 2 p.m. and her tooth breaking? Not a single one of you. So stop lying to your patients. Are you really concerned about their tooth breaking? Not really. It's their tooth. It's their mouth. Whoever cares more owns the problem. They have to care more. And so as soon as you say you care and you're worried, guess what they get to do? Not care and not worry. This is on them. And then you never have to worry because what's your ability to complete treatment plans? 100%, because what did they pick? Nothing. Guess what my first treatment plan was? Nothing. Feels pretty good, right? How many people do you know that have a 100% success rate on all the treatment plans? Now you do. If you've done it properly. As long as they understand the consequences of your decision, you're done. Now, you have a patient that trusts you, that's been seeing you for the last 30 years. What do you do when you see this tooth? Tell them they need a crown. Yeah, exactly. So don't go through this rigmarole for the patient that's been with you for the last 20 years. Like, that makes zero sense, right? Patient comes in, they've known you for a while. You should have already done this if they've known you for a while, but if you haven't, or, they've referred their dad who knows everything and they're like, look, my dad needs the best treatment. What are you going to do for them? Do not do everything that I just did. You've wasted everybody's time, okay? Just tell them what they need, because once they trust you and they value your treatment, you can get to this point extremely fast. But the patient that has never met you before, you need to be more mindful of that, or the patient that's distrusting. And we are getting more and more patients coming into our offices that don't trust the dentist. I mean, most of our patients don't trust the dentist, right? We're not much better than lawyers in terms of like earning trust. Whereas back in the day, I'm not going to point out too many people, but Larry, you've been doing this for a while. Like, there was more respect in dentistry than there is now, I believe. Yeah. Right. So we have to build that back up, because what's changed? That's on us. If there's less respect in dentistry, this is like one of those look in the mirror problems, right? We have caused whatever we're doing right now. So then you go through all of this and you use your technology, you take your scans, you use your iTero, you wow them with the technology that we have, because most offices don't have that. And the AI that we have, honestly, it's amazing. And I think I've talked to you guys about the value of AI, but here's the downside, or the upside, is that the patient trusts AI more than they trust the dentist. That is now proven. They've done research to show if a dentist gives them a treatment plan, they believe the computer more than they believe the dentist. Why? Because it has no skin in the game. The AI cannot make money off of these procedures. They truly believe, our patients still believe, that our motivating factor is money. And that if we're diagnosing with a portion of our pocketbook, or their pocketbook. Which is a really cool meme. I don't know, it was really funny, I thought, about this during the World Series, a dentist diagnosing their patient. Did you guys, any of you see that? The guy's like on StubHub, and it's like 2 tickets to Game 7 of the World Series, and it's $7,352. And he gets into his next patient, and they're like, oh, you need to do this, 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 and the total is $7,352. The guy's like, the assistant's like, where did you come up with that? I was like, that was his StubHub bill for the 2 tickets that he just bought to the World Series, right? And I thought it was funny but that's the funny part about it is that's what patients actually think. That's the sad part about it, until they trust you. And then they never think that again, right? Your patients that trust you don't actually believe that. So show them, don't just tell, ask open-ended questions. Hey, what do you think? What do you think's going on? And ask them what they want. Why are they here? Why did you come in and see me? What is it that you're looking for at the dentist? Because if we know where they are, we get to meet them there first, right? And sometimes I feel like we're not figuring out what their chief complaint is before we get into the things that we're talking about, right? They want whiter teeth. Okay, we can help you. Got to fix the bomb first, but we can get you some whiter teeth, right? Whatever they need. And then consistent messaging. And so this is where the systems come in, is like, how do we create consistent messaging from the back to the front, and then from the front to the back, and then back to the front? We've done this. I do believe that you guys need to be talking about fees. And guess what? It's not that hard to figure out, because TREC tells you the fees. You don't even have to figure it out. You literally treatment plan a crown and tells you how much it costs. And again, I don't expect you to quote everything out. That's not what I'm saying. But if you're not giving your patients a ballpark of what's going on, you're leaving the front out to really manage a lot more. And so a bit of a ballpark, or an exact amount if you're comfortable doing it. But I do think that it's important that they hear it from you before they hear it from the reception team. And then, are we booking in the back? Again, the chance of you booking in the back is higher than them booking at the front, which is higher than them leaving the office and you calling them back to try to book them in. Every patient needs to leave of employment, whether it's hygiene or restorative. And if you've diagnosed something, book them 4 to 6 weeks out and let them know that the team up front will figure out the finances, they'll figure out the insurance, and they'll let you know your exact cost before you come back in. And if that doesn't work for you, great, we can change that, right? So make sure that we're doing that. I'm speeding up just because of timing, and we want to see some other pretty cool technology that they're going to show us here in just a couple minutes. So I think all of you, short of Evan, have seen this pyramid, hopefully, because he hasn't done the new team orientation, but anybody else has. The Pyramid of Trust. Patrick Lencioni, if you have a chance, just read his book, 5 Dysfunctions of Team. It's fantastic. I have a fun part about this, but we won't go through it. But in order to build a trusting relationship, we need to be vulnerable. And the problem with society right now is that we feel that if we're vulnerable, somebody is going to hurt us. And that's actually the opposite, right? The people that we trust the most have been with us around the longest. We talk to a lot. We have great conversation, right? The interesting thing is, after trust comes conflict. Most people think communication, but actually the right answer is conflict. So who here likes conflict? Oh, there we go. It's a peanut butter brand. My answer was women, but that doesn't usually go over very well in dentistry, which is 99% women. I'm joking. But it actually is true, and which is why they have better relationships. Because what do guys do with their feelings? Why do we have a problem right now with suicide with men? How much do they talk about their problems? What about women? That's conflict. Having a conversation about how you're feeling, even though it doesn't seem like it, that is actually conflict. Because you're trying to deal with a problem that you're having. And so having open, honest conversations, that's not easy. That takes a lot of effort, right? And how many of us want to have those, right? Like when your wife says it's time to sit down and have a chat, how many of you are not feeling very good right now, right? Well, the women and the men are laughing because it's like, you guys want to talk to us a lot more than we want to talk to you. Let me tell you that, because we're generally not like doing about anything, man. We're in trouble more often than we're not in trouble, I feel like, right? Yeah. We all know it's true. It's okay. We're comfortable with coming up with commitment, right? Figuring out how to get through those challenges, because here's the thing. Relationships that have been tested and you get through are a lot more stable than relationships that have not been tested. And we know that because nobody that's been in a relationship for a long period of time has not had at least some level of challenge through that. And either it breaks you or it brings you closer together. And that's where conflict actually works. It gets us to commitment, and it allows us to create this level of accountability. And I don't believe that the goal is results. I believe the goal is service. We serve each other, we serve our teams, we serve our families, we serve our patients. Our goal is to figure out how to get through all of this to serve people better. Okay. So how do we unite our different clinic cultures under one common goal? So one of the things, and I'll just give them all three, something that we're going to actively work on as partners, as dentists, as team leads, as teams in general, is taking our values, which I hope all of you know, and breaking them down into actually customer service expectations. And what does that mean? Well, we're not necessarily sure because we want to work on this, but one of the simple ones is every patient that walks into the office greeted by their name? I'll tell you right now that's not happening, okay? But why isn't it happening? How many people randomly walk into your office that don't have a patient, that don't have an appointment? And I could say at Royal Oak and Creekside probably happens a little more often because you have waiting rooms that you share with other people. But for most of our offices where our waiting room is just ours, how many people like walk in there and be like, oh, I have no idea why I'm here. I just felt like walking into the dentist office. So we have to know who's walking through the door, right? We do. And do we have pictures of these patients? Well, as long as they're not the new patient, we should. And if we do, then we should know who these patients are. I experienced something, unfortunately, so give the good about Ranchlands and I'll give a bit of a challenge that we had, but I came in on Monday to see a patient just to do a fit. Patient walked in, person at the front desk says, hi, do you have an appointment? The lady looked at him and said, why else would I be here? And I was actually at the front desk, but my back was to her, so I didn't see her. It was my patient that actually had come in for her fit. And I looked at the schedule, and there was only one other patient in this was just right around lunchtime. So there was literally nobody else coming. And she'd been a patient for 20 plus years. Right now, and it was one of our newer staff members, but that's not okay. Because we've created a system around that not being okay. We have to know who's coming into the office. That's like customer service 101. So one of our base level standards is, if it isn't already, but it will be and we will write it down, that every patient that comes through the door is greeted by their first name. It can't be that hard for us to do. We have to be able to figure that out. At least 9 out of 10, if it isn't 10 out of 10. Because there may be that one unusual situation where you can't know who they are because they did just happen to walk in that day. Okay? So
Did you use that situation as a coaching moment for that team member?
So no, I didn't. And that was the interesting part because we had a conversation about that after, but I didn't with the team member. And that's obviously on me. There was more people at the front and there was patients in the waiting room, but pulling them aside or having some level of conversation, this is where the spike list comes in. And so then to my problem is that I should have walked to the back and put that on the spike list. So tomorrow morning at our morning exam, at our early morning meeting, we talk about that with everybody because that's a teaching moment for the entire office, right? So that's where you have to take it to the next step, otherwise it won't get better, right? So we are going to set those standards. There was a number of people that went to, again, that RITS experience. I mean, some of this is not necessarily going to come out of that. It's just going to come out of some basic understanding of what we do. But we have a lot of information and we want to create some levels of expectations and then a customer service experience that is above the average. And then from there, we set a standard for our offices. And then if you want to do more than that, you absolutely can. But we need to have a level, and I wouldn't say a base level, a high level of what that customer service ends up being. So I'm gonna leave it there because we're gonna ask you guys to help us create this as dentists, as partners. We're gonna get team leads involved, and then we're gonna get the team members involved because ultimately if the full team is not involved, they're not gonna buy into this whole thing. So they have to help us create it, and so we haven't figured out quite how yet, apart from we're gonna start with a survey, which I know you guys love because we send these to you all the time. But we gotta start somewhere with creating a basic understanding, and then we're gonna ask people who want to be a part of creating this to come together and to help us figure out what this means for TREC as a whole, so that all of our 17 clinics have a standard, and then each of you gets to go and do, still have your own autonomy as to how you do it, but there has to be a base level of what we're going to achieve.